Well, good morning, everybody, and welcome to RAMP, Real Access Motivates Progress live podcast. We're doing these sporadically lately, and we have a great topic, a very important topic that everybody needs to be talking about at this time. We are talking to the Rhode Island Special Needs Registry today, and I cannot wait for you to hear all that they have to say. I'm going to bring them to the stage. Good morning, Andrea and Matthew, and welcome to the show.
Good morning.
Good morning.
We so enjoy having you, and I know this is very important information that we need to get out. So let's start off very easy. Andrea, tell everybody who you are and what you do.
Yeah, hi. Thank you so much, Tina, for the opportunity to be on the podcast today. My name is Andrea Creach, and I work at the Department of Health within the Center for Emergency Preparedness and Response as the Community Initiatives Director. And one of the primary roles is to manage the Rhode Island Special Needs Emergency Registry. And I'm really excited to talk to everyone about it today. I have over 15 years of experience at the Department of Health in public health emergency preparedness and response. I've worked a lot, throughout the community with a lot of community-based organizations and have a lot of experience, working with people in the community and talking about preparedness and especially the registry. I've worked through various responses at the Department of Health and have a lot of knowledge and experience there. I am a mom of three school-aged kids as well, so I bring that to the table as well. So, a lot of great experience and knowledge, and happy to share all of that with, anyone who's listening in today.
And you are absolutely amazing, and thank you for that. And just so you know, if you catch me looking down at something, it's because I'm looking at all of our live viewers and any questions that they may have, because I don't want to miss them. So I'm not ignoring, I'm just keeping track of everything that's going on. Matthew, without further ado, tell everybody who you are and what you do.
My name's Matthew Raymond. Thank you, Tina, for having us. My name's Matthew Raymond. I work at the Rhode Island Department of Health as well, and I work for the Rhode Island Special Needs Emergency Registry. I started working here last January with Andrea. I've been helping managing the database as well as, doing other things. I have not been in any emergencies. I probably shouldn't say that out loud because who knows. I am a father of two young girls, 4 and 2. It's tough. They keep me up all night. And now I'm here after 3 hours of sleep, ready for the podcast. So.
That is amazing. I am so excited to have both of you, and I want everybody to learn about what it is. Now, Andrea, tell everybody what the Emergency Special Needs Registry is. Tell everybody what it is and who should be knowing what it is.
Yeah, sure. So the Rhode Island Special Needs Emergency Registry, or RISNR, so we will refer to the database as RISNR as we talk throughout this podcast today. It's a voluntary statewide registry for Rhode Islanders of any age. So, we register NICU babies coming home that may have special healthcare needs, all the way up to our older adults that may have, a special healthcare need, a chronic condition, a mobility issue, something that means that they may need a little bit of extra help in an emergency. We work to provide key information to first responders, inside emergencies and day to day.
It's so important because, we just had all of those floods and everything. And I know FEMA has come in, but, when it's something like a flood, somebody like me, how do you get me out? How do you get my 400-pound wheelchair out, not counting me out? Where do you do? What happens if my wheelchair got ruined in the flood? Where do I go next? These are the important things that we need to know. Matthew, tell everybody how it works.
Okay, so RISNR works, how RISNR works. Anyone who identifies as having a particular healthcare need because of a chronic condition, mobility concern, or a disability can enroll in the registry. If someone who is enrolled in RISNR calls 911 because they are experiencing an emergency, the 911 operator will see a banner across the screen that lets them know the individual is registered. The 911 operator can tell dispatchers that there is someone on the registry at that phone number. There are also select municipal emergency responders who have access to RISNR. They use the registry as a planning tool before, during, and after an emergency. The Reisner teams work with Rhode Island's 39 city or town emergency managers or their designees to ensure that they are able to log in and download registrant information as needed. The Reisner team can also assist municipalities in utilizing the Geographic Information System, or known as GIS, to map the area around where an emergency is happening to see if Reisner enrollees in that area may require additional assistance. Just an example, during the January 2019 Newport gas outage, municipal leadership used Reisner to conduct door-to-door wellness checks. They could also use Reisner to help recharge batteries for life-sustaining medical equipment, to replace oxygen canisters, or prioritize tree removal or plowing. It is important to note, however, that being in the registry does not guarantee assistance during an emergency. Being registered puts you on the radar of local and state responders during an emergency.
That's great. And just for those who may not know, because I'm dyslexic, so I never know what organization I'm going to other than AAA. It's the only one that I can get the letters in the right order. Reisner is the Rhode Island Special Needs Emergency Registry. Shortened is Reisner. Okay, Andrea, we're going to get into the nitty-gritty now. We know Rhode Islanders do not like to register for anything because they don't like their information out there. They think that everybody is going to do something with their information that they shouldn't. So tell everybody how the database and how your information is secure with Reisner.
Yeah, of course, Tina. I mean, this, I think, is one of our most important questions, right? We understand that people are concerned about sharing, their information, especially personal health information, right? I think, this is something that we all keep really close to us and sometimes don't even share with those that are the closest to us. So we are really dedicated to ensuring the security of all of the data that's entered into the registry, and even just data that we collect in the field, right? If we collect enrollment forms in the field, we have locked bags that we carry them in. We have every effort to make sure, that we are taking every precaution with people's data. The registry is HIPAA compliant, of course, and access is protected and only available to select emergency responders in each municipality. That said, when someone enrolls in Reisner, they are consenting to share their information with local and state emergency responders so that we are better able to assist them in emergencies. We work very hard also to ensure that the data is accurate. We do a lot of routine data cleaning, including working weekly to reconcile against the Rhode Island Department of Health's Center for Vital Records decedents list, as well as, we conduct a biannual mailing where we ask individuals that are registered if they have any updates, right? Has their information changed? Finally, I think Reisner enrollees or their family members can contact us at any time to request being removed from the registry and to update information, of course. It doesn't have to be during only that biannual cycle. And it really is important for me to note here as well that we really only use the data for emergency planning and response. We do not share the data that is within the database with any other, partners or people that request it. We really only use it for preparing for emergencies and then responding to them.
That's awesome. It's so important, especially remember that when you move or when your loved one may have to go to the hospital for a long period of time or for, a nursing home or whatever, if they get to that point, make sure you're letting people know that they stay on the registry, but we need to know where they are because we all know that anything can happen. We want to make sure that we're safe. If we had a great snowstorm, I am so glad I'm registered. They know where I am out in the bowels of Burrville. I love being a Burravillian, but I am in the middle of nowhere. Matthew, our next question is actually fit in with the question I was going to ask you, but we have a live question that we're going to ask you. Is there a charge and do we have to put our credit card in to register for this fee? So Matthew, take it away.
Is it free? Reisner is free and voluntary. You only need to enroll once. If you move or your healthcare needs change, you can contact the Reisner team to update your information. Reisner enrollees can also ask to be removed from the registry at any time. Just call.
Tina, I'd like to address that question specifically. We will never ask for any credit card information, for your social security number, for health insurance information. We do not need any of that information to enroll someone. So our team will never, ever ask for any of that information from.
What about the social security number? That is not asked for either, correct? So do not ever give them your social security number. Do not ever give them a credit card. So really the only information they have is public information that's already out there that if I wanted to know where you live, I could go look it up. That's the only information that you're giving out and what your disability is. I mean, everybody knows that I'm in a wheelchair, so it's not that I'm giving away information that, people can't figure out anyway. But it's good to register and it's important to register. So make sure that we're doing that. Andrea, we got some live questions coming here. So we're gonna go that route. What does people need to do to prepare? Like, what are some of the things that they can do to help themselves?
Yeah, so, I think that we talk a lot about preparedness and steps that people can take in an emergency. And we really look at, 3 basic steps. So making a plan, building a kit, and staying informed before, during, and after the emergency. We'll get into that, in a little bit and kind of break that down a little bit more for folks. But I think that those are really, the key basic steps. And I think, of course, enrolling in the registry, if that applies, is something that is, of course, the biggest recommendation of them all.
And remember, they can't give you an overall. Everybody is individually different. I mean, I happen to be in a room with 38 other spinal cord injuries, and every single one of us were different. So you got to remember that your plan has to fit you and your family and your house and whatever. Matthew, here's another question that was just asked. If they had to evacuate, do they take your service dog or any pet with you? Service dogs, we know we have to. So how do they take care of them? They keep them with the person. And what about if you have pets at home? What do they do?
So we encourage you, to keep your pets, vaccinated, the ID tags up to date. If you had to evacuate, shelters, an animal shelter is not going to take your pet most likely if it's not vaccinated. So, we do go over those steps during our personal preparedness presentation. We'll say, make a pet kit, include, ID tags that are up to date, leashes, dog beds, cat carriers, things like that. Andrea, do you have anything else to add?
Yeah, I think that the most important part to think about that is a lot of people look for hotels in their area that allow for pets. Because, like Matt said, not all shelters allow, animals other than assistance animals. So, thinking about your pets is important. Of course, when we're talking about building kits a little later, you need to make sure that you have enough water for your dog, just as much as you need to make sure that you have water for, the humans in your home. So, I think that those are some of the key tips. I think the other thing we always say is to have a picture of your animal, just like you would have pictures of the people that are in your home. Have pictures of your animals too, in case you are separated from them. That's another way that, you can either make flyers or just get the word out there about that animal.
Always be prepared. I always keep a bag of dog food aside that I can, just grab and take with me. I update it, obviously, to make sure I have a sticker on my window saying this is my service dog, this is his breed, this is, his vaccinations. I keep that up to date. There's so many ways that you can keep it up to date for your animals. But again, the picture is a great thing because if there's a fire or a flood or something, they may get nervous, they may run, they may go out. So at least we can be able to attach them. I would say get them chipped. That's the easiest way to keep everything up to date because I know I have mine chipped and I can update the chip. Just got his vaccination, just got this. So they can just scan the chip and know everything and you don't have to do another thing about it. Matthew, what are we missing? What are some of the things that people aren't thinking about and why they should register?
So who should enroll in Reisner? Really anyone who thinks they may need extra help during an emergency. Just for example, people who use life support systems like oxygen, ventilators, or respirators, or people who have chronic conditions and will require treatment, like people who have diabetes and require insulin. Also, people who have mobility needs and who use a wheelchair, scooter, walker, or cane. Some people who are visually impaired, blind, deaf, or hard of hearing. People who have speech, cognitive, developmental, or behavioral health disabilities. And also just older adults and those who maybe find it day to day, but may require extra assistance in emergency situation. And people who use assistance animals. So all these people should consider enrolling in Reisner. Enrollees can be any age, but must have a physical Rhode Island address.
Another question we know that's going to come up is those with invisible disabilities that may impair or impact. I mean, those who are allergic to peanuts, those who are allergic to latex. You know, somebody comes and touches you with latex gloves with COVID going on. Should those people register as well?
So we do have a text box, a free text box. You can write in anything. I mean, you know, from second address that you want to add to, you know, I use a CPAP machine at night, to really anything that you want to add that you can think of.
Yeah, I mean that's all the things that I can think of. But Andrea, this one's going to go to you.
Yeah.
Is there any wrong person to try to register and realize that maybe they don't need it?
You know, Tina, I haven't seen that much in the almost 10 years that I've been working in this program. I think our enrollment form, really has a lot of checkable boxes on it that make it, pretty easy for people to see, whether or not, it is applicable to them. I have had people ask me certain questions, and most of those do lead, to them registering, right, about their own personal situation. As we mentioned, Reisner is really for people that have chronic conditions too, right? We want to especially think of individuals who may have diabetes, especially if they have insulin that is stored in the refrigerator. We think about those people in the event of a power loss. There really isn't many things that I think that people would approach us with that we would turn them away from enrollment. I think as long as they, can check a box on the enrollment form or has something that isn't there that, would be applicable, we're certainly going to support their enrollment.
And I'm going to throw this out to either one of you who want to. What is Reisner doing for outreach so more people know about this?
Okay.
Yeah.
Do you want me to answer that?
Yeah, no, it's fine. I can do it. All right, go ahead, Matt.
Okay, so we offer 3 types of outreach to people who want to learn more about the registry and how to prepare for emergency. This outreach is provided at no cost to community members and is available in English and Spanish during the day, evenings, and we come out on the weekends as well. We do the introduction to Reisner, which is just a 15 to 20-minute information session. It includes an overview of the registry, explains how and why to enroll in Reisner, and explains how we protect the information you submit. We also do a personal preparedness 101. This is a 1-hour presentation. It explains how and why to make an emergency plan, to build an emergency kit, and to stay informed during an emergency. This presentation also gives an overview of preparedness resources in Rhode Island. The My Emergency Plan workbook and other materials are provided to presentation attendees. So we, pack a little swag bag with a bunch of stuff, some mini flashlights and other things in there, a whistle. We also do community outreach table and community outreach tables with materials. So if you're organizing an event or know of an event in the community, just let us know. We have team members who can talk to community members about the registry and preparedness and provide brochures and informational materials. So Reisner program materials are available to be ordered on our website, and you can contact us to schedule outreach for your community. You can email us at ridoh.risner@health.ri.gov, or you can just call us at 401-222-5960 and just ask to talk to the Reisner program manager.
And if you forget all of that, you can just reach out to me and I can put you in touch with them. So if you didn't have a pen to write all of that down, and you don't want to rewatch this 100 times, you can contact me and I can put you in touch with them all. But that is fantastic. What you guys do is so invaluable. How much has Reisner been activated with some of the emergencies and the flooding and all of that? Has it been activated in Rhode Island?
Yeah, so I think, recently, the Federal Emergency Management Agency has been here in Rhode Island, and they've had disaster recovery centers that have been open, first for the September 2023 storms, and then for the storms that took place in December of 2023 and January of 2024. So we were able to work with our partners from the Federal Emergency Management Agency and the Rhode Island Emergency Management Agency to do some text messaging to Reisner enrollees to let them know where the disaster recovery centers were and how they could get assistance if needed. Aside from that, the registry is really used, by our municipal partners, for any smaller local emergency that may occur. But it was used during COVID-19 in the early stages of our vaccination campaign when we had very limited vaccine supply for those 75 and older. Some of the municipalities did use the registry then to help identify, 75 and older registrants that would need to be vaccinated. Matt spoke a little bit about the Newport gas outage in 2019. I think that was really the biggest one in recent years. I do think that, the day-to-day connection to the 911 system, is really something that all Reisner registrants benefit from day to day when they need it.
I agree with that. Here's a question. It's a little in depth, so let me get through it. If there was a fire in my home and 911 was called, do they automatically get notified that I am in a wheelchair? This is not me. I'm reading it off the screen, but this would be me. So this is why this question popped up to me. Would it automatically notify the fire department that I'm in a wheelchair, that they need to come and find me? Is that how it connects?
So at this time, the 911 operator will see that someone is on the registry. I always tell individuals and families who I speak with, when you're calling 911, make sure that you tell the dispatcher what your needs are. And then when you do call 911, you are then, transferred from the state dispatcher to a local dispatcher, which is why sometimes we're asked to share what is happening with us a second time. So at each of those points, I would be sure to tell the 911 operator. And then, of course, any first responders who show up at your door, what they need to know about your situation.
The one thing I see about that is if my house is on fire and I live in Providence, and my house, a passerby calls and says, "Hey, I just noticed this house is on fire," and called the fire department where they know nothing about me. How is that connection, or how does somebody know, to look for somebody like me?
Yeah, I think that's, part of, where it's not a perfect system, right? Because in that example, the individual isn't calling 911 themselves. So that banner that flashes across the dispatcher screen is not going to happen. I think thankfully, our first responders are very well versed in, how to respond to any and all of these types of emergencies. And they're going to, especially in the event of a fire, I would imagine, break down doors to, make entry to find out if there's people inside.
Yeah. The one thing I know I do is when I moved, I made sure I wrote down to my nearest fire department and let them know who I was and where I was. That it's not a bad idea to just kind of say, "Hey, I just moved into the neighborhood. I'm in a wheelchair," or "I'm this," or "I'm that," and let your local. They were fabulous about it. They now come and check on me when there's a storm or something like that. So even register, but even letting your local fire department know is a huge aspect to keeping yourself safe. Whatever we can do to keep ourselves safe, who cares? Who knows? People see me in a wheelchair. It's not a secret. I don't care who knows. Matthew, what else can people be doing that we haven't talked about yet today?
What are some steps to prepare now? Some 3 basic steps to help you be prepared are to make a plan, build a kit, and stay informed before, during, and after an emergency. Let's talk about how to make a plan. Reisner has put together a workbook to help Rhode Islanders make their own emergency plans. It's called the My Emergency Plan Workbook and can be found at our website at health.ri.gov/emergency plan. The workbook takes you step by step through what you need to do to prepare for an emergency and includes activities like a personal assessment and how to build a home or car emergency kit. As you are making your plan, think about whether you're enrolling in Reisner is right for you. Hurricanes cause flooding and loss of power. If you would need extra help because of a flood or a power outage, can you enroll in Reisner today? Another part of the planning involves knowing your risks. For hurricanes, this means knowing if you live in a flood-prone area, knowing if you live in an evacuation zone, and knowing if your home is likely to flood. So back to the pet thing, I'm just going to tell this story talking about flood. So my dad lives in North Kingstown, and they flooded. They told him to evacuate. He has his dog Summer. He's like, what am I going to do? This is before I worked in this office. I'm like, I don't know, call a hotel. And he said there's all no pet policies. He did reach out to the closest hotel, and they said that we'll waive the pet policy. And I know Andrea talked about that, but it's good to call ahead. Just another important part of having a plan is ensuring you and your family have a communication plan. Oftentimes during and after an emergency, it can be difficult to make calls, so texting is preferred. Make sure you write down important names and phone numbers so that you will have information available if there's no power to charge your cell phones and other devices. You should also identify a meeting spot where you and the closest to you can plan to meet if you are separated during an emergency. Andrea, do you want to add some stuff? Sorry.
I think that Matt hit the nail on the head. I think, this week happens to be Hurricane Preparedness Week, Tina. So, as we are preparing, of course, living in the Northeast in Rhode Island like we do, I think this time of year, it's a good time of year for us to think about preparedness, and to think about the ways that, we can get ready for an emergency. We always like to say that it's better to plan for the emergency on blue sky days, right? And not wait until the emergency happens. So I think that that's really key. We really talk about, of course, the next step in emergency preparedness is building an emergency kit. And, Tina, as you said earlier, I think, really understanding your needs is the most important part there, and
Right.
making sure that you have all the things in your emergency kit, that apply to you, which may be different than what I need in my home and different than what Matt needs in his home. So I think, of course, the main things I kind of have, behind me over here, some of the kit items that we recommend. Of course, people need water. And most people don't understand that it's a lot of water, right?
Right.
It's 1 gallon of water per person and pet per day for 3 days is what we recommend that everybody has as a stockpile in their home. So, I have 5 people in my home, so 15 gallons of water at a minimum. I probably have a little bit more than that in my kit. But of course, we ask people to think about non-perishable items, non-perishable food items, but think about food that you'll eat. I think that that's the most important advice I can give to people there. A lot of people look towards meals ready to eat, or MREs that are, what the military uses. And you can order those on Amazon, but not all of them, taste great, and people aren't used to eating food
Right.
that way. So that's the biggest thing we can recommend there. But of course, things like a first aid kit, flashlight, a manual can opener for food in case you have no power, extra batteries for your flashlights, and then a battery powered or a hand crank radio, so that you can still stay informed during the emergency is also important.
It's so like saying somebody like me, I need a portable generator. I mean, a house generator, because I'm in a wheelchair. Everything that I use has power. If I'm out of power for an hour, my oxygen's not working, or this isn't working. Like, it's major emergency. But you brought up a good point, because all of this being prepared early is The ramp has the ramp red bag system where we have a 3x5 and a 5x7, which holds an EpiPen and more stuff that we put a card in each one of our bags that tells you exactly what you should have on you at all times. And this information stays private, that only you hand these red bags to the EMTs or the doctors that are taking care of the person. So you never have to tell anybody you don't want to know your medical information. Like I know somebody who, is schizophrenic and stuff. It's in her red bag. She doesn't have to tell anybody else because only certain things trigger her. So she gives them to the EMTs. They know in case she's triggered. So you can get these bags on our website. They're $4 for the small bags and $6 for the large bags that I just threw on the floor. The large bags are brand new. It's upside down. So go and grab those. We're going to be working with the special needs registry. Hopefully they'll be handing out some of the bags when people get registered. It's just a nice way that if you're not home and there's an emergency, to have your information on you at all times. They all have a hook on them, so you can hook them onto your wheelchair, your walker, yourself. My son carries his in his wallet. So you can always have it on you at all times. This was such an informative information. Matt, I'm going to ask you to give you a 1-minute roundup of why people should go out of their way to see if they're right to register.
I think it's key. I knew this question was going to go to me first. So it's a great registry. I mean, I worked in plenty of departments and, I honestly love the registry. I'm not just saying that because I work here. I mean, I've heard so many success stories from, our presentations, that, oh, this helped me, it helped me get better prepared. I love being in the registry, it, puts me at ease during an emergency. I just had a guy yesterday, I was going back and forth with him and he said, why don't you guys, advertise us more? I mean, we do. We're, out there, we're doing outreach. We're trying to get as many people registered as possible. I just think, if you need a little extra assistance or emergency, enroll. I mean, it's just a big thing. I mean, it will help you and, you want this, in an emergency. So.
You're just a giant safety net. I love it. You're just a giant safety net. It's that extra layer of caution that if you can't speak or you can't talk or you don't know where somebody knows where you are, you guys know where you are. So Matthew, thank you so much. Andrea, here's your 1 minute of fame. What is your 1-minute roundup of why people should be involved?
Yeah, I think, I definitely echo what Matt said. I think, our program here in Rhode Island is really a national best practice. We talk to other jurisdictions throughout the country about the registry and how they can start to do something of its kind there. So, it really is, and has been tested and we've seen how it can work and how well it can work. So I really think, if anyone has any questions, please do not hesitate to reach out to us. Again, the phone number to give us a call is 401-222-5960 and just ask to speak to someone on the Reisner team. We're happy to help as much as we can. And, again, I think if anyone has opportunities for outreach for us, please let us know. We're a small team, but we're a mighty team. And, we're really getting out there and trying to spread the word, not just about the registry, but about preparedness, because, our little small state here of Rhode Island, the whole community of Rhode Island will be stronger the more prepared we are as individuals and families in our own household.
You're absolutely right. And if you forget the number that Andrea just gave you, or you forget to reach out to me, you can always call 211 and just ask for the special needs registry, and they can refer you when you have a pen or an email. So we always have that backup. So Rhode Island is very good at always having a backup to the backup. So make sure you're reaching out. Thank you both for coming on today and sharing everything that the Rhode Island Special Needs Registry does. It is a very important part of Rhode Island, and this conversation does not end here. We will have you back to talk about more things, or if there's an emergency coming up, we will have you back to help guide people. But thank you both so much for joining us today.
Thank you. Thank you so much for your advocacy and, for just helping us spread the word. We appreciate it.
Yeah,
thank you. So that was all about the Rhode Island Special Needs Emergency Registry. It's something very important that you need to be part of. So thank you all for tuning in today. Thank you all for doing something a little bit more than you should. If you know there's somebody in your neighborhood that you think should be registered, talk to them about this. If you've seen this, share the video with them, share the information with them, making sure you're taking care and being a good neighbor. And as I always say, don't just sit there, make a difference, and we will see you all soon.